Your passcode has been confirmed. If you need technical assistance during your call, press *0.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign.
Good afternoon and welcome to the CDC's Hemoglobinopathy webinar series. I'm Shay Pope from the Division of Blood Disorders and I'll be serving as today's moderator. As the conference leader, I have muted all the conference lines to eliminate background noise. After today's presentation, we will allow questions. And at that time, you'll have to press *6 to individually unmute your line at that time. If you have a question, you can electronically raise your hand by accessing the Q&A tab on the menu bar of your webinar screen and click on the hand icon in the upper right-hand corner. This will display your name to the moderator, and I'll call on participants as their names are displayed. You can raise your hand during the presentation, but we will wait until the end to address those comments. Also, this session is being recorded. Today's topic is the discovery and early history of sickle cell disease. Todd Savitt is an historian of medicine with an interest in African American medical history. He received his bachelor's from Colgate University, attended the University of Rochester School of Medicine, and earned his master's and PhD in history from the University of Virginia. After teaching at the University of Florida College of Medicine, he joined the Department of Bioethics and Interdisciplinary Studies at the Brody School of Medicine, East Carolina University, where he is the Assistant Dean for Diversity and teaches history of medicine, literature in medicine, social and cultural issues in medical practice, and medical ethics. Dr. Savitt has published books and articles on such topics as the health of slaves, the history of sickle cell anemia, sudden infant death syndrome, use of African Americans for medical experimentation, the entry of black physicians into the American medical profession, and early African American medical schools and medical journals. So at this time, I'd like to turn the webinar over to our presenter, Dr. Savitt. Sir, if you could please unmute your phone by pressing *6, and you can begin to address the audience.
Hi, am I on?
Yep, we can hear you just fine.
Terrific. Okay. Well, this is exciting, and I hope you'll all find this interesting. I'm going to talk as a historian about the history of sickle cell. So one can talk a lot about the history of sickle cell disease. There are a lot of topics, and many of them have been written about, and there are folks working on other aspects of the history of sickle cell. One can look at the history of sickle cell just like the history of any other kind of topic from especially in the sciences, from an internal or an external point of view. And if you could go to the first slide, please. Next one. Next slide. Yeah. So you can look at the history of sickle cell from a kind of internalist perspective. That is, who did what when? Who were the folks involved? What did they do? When did they do it? Kind of dry high school or junior high school history that you might have taken. And you could also look at, especially with sickle cell, the kind of developments that took place. For example, sickle cell was the first molecular disease that was recognized. How did that happen? Who were the people involved? What were the events? Next slide, please. that sort of thing is interesting and helpful, but for the kind of history that I'm interested in doing, it doesn't quite satisfy what my desires are. My interest is in the interaction between medicine and society, and that's called the external history of medicine. That is, the people part of history, the people part. What kind of interaction takes place between medicine and society? I'm going to focus the talk today kind of selfishly on my own research into various aspects of the early history of sickle cell from the research that I've done. So what's interesting about the social history of sickle cell is that it differs from country to country because of the society in which the developments took place. So sickle cell was discovered in the U.S. That was the first cases were recognized in the U.S. What's interesting about that is that because of the history of race in this country, in the United States, the discovery of sickle cell had an impact on the history of race. That may have been true in other countries in different ways. In this country, it's very specific. And it's something that I'm not going to spend a whole lot of time talking about. I'm going to focus my talk on the discussion of the discovery of sickle cell and talk a little bit about race as it's involved there. But I'll come in a minute to some, if you're interested in other folks, in writings from other folks about the history of race and sickle cell. I'll provide you with a little bit more information in a minute. What I'm going to do is focus my talk on the first two patients who were recognized as having sickle cell anemia in this country, the first two published articles on sickle cell in the medical literature, and their physicians, and about the differences and similarities between those two. Then I'm going to talk, depending on how much time we have, a bit about the origin of the word crisis, because in sickle cell we use that term sickle cell crisis, something that I wondered about, where did that come from? So I would like to talk a little bit about that. And then, if there's time, again, I've been working most recently on the first 20 years of articles about sickle cell and who those early sickle cell patients were beyond the first two, and who were the physicians and researchers who wrote those articles. So just to give you a sense, if you're interested in reading more about any of the things that I talk about today, I've written several articles, and I've put them up here for you to see. The first couple. The first one is about the development of recognition of sickle cell in the U.S. After its discovery. Second one is I'm going to speak a lot more about today, the first case, the 1910 case of sickle cell. And then the second case, I'll also talk about that. You see the reference there. And that fourth article there, that tracking down the first recorded sickle cell patient in Western medicine, is a kind of story of my adventures in tracking down who that first who the first sickle cell patient was. And then two unpublished articles that are in press, one about the history of the word crisis in sickle cell, and the other about early patients with sickle cell. So, let's first talk about the discovery of sickle cell in 1910 and 1911, the first two cases. And you see the title I put to this, Race, Class, Authorship, and the Discovery, in quotes, because sickle cell had been known before that, although though not by that name, of sickle cell anemia in 1910 to 1911. A fascinating story of people, who they were and what brought them together. And the story provides some insight into the society in which sickle cell existed at the time, at the turn of the 20th century in the United States. So a little bit of personal reflection here I'll intertwine that with the factual part of this talk, because they're kind of inextricably wound together here. I was a medical student for a few years, as Ms. Pope mentioned it in my introduction. And I remember in 1965, when I was a first-year medical student, reading this first article. Here it is on the screen here. The first article about sickle cell anemia that was reported in the medical literature. You see the author is James B. Herrick from Chicago, and the title, Peculiar Elongated and Sickle-Shaped Red Blood Corpuscles in a Case of Severe Anemia. If you look at the second paragraph, you'll see where it says history. It identifies this patient as a professional student from Grenada in the West Indies, as an intelligent Negro who's been in the United States for 3 months, during which he was a student at one of the professional schools in Chicago. So I, as a first-year medical student at the University of Rochester in the middle 60s, should have been focusing on the clinical aspects, but my historical mind was already working. I would soon leave medicine and go into history. And I wondered who this guy was. What did he look like? What kind of person was he? That kind of thing. But of course, patient anonymity was respected then, as it is now. So then I decided to leave medical school after a few years. History was my calling, I thought. And I went to University of Virginia to study history as a graduate student. And in around 1970 or so, as I was going through, I had an opportunity to look at the University of Virginia hospital admissions books, the very first ones. The hospital opened in 1907, and I came across the second reported case of sickle cell anemia. And you see the arrow here pointing to number 433. Her name was Ellen Anthony, and I'll say a lot more about that later on, but you see the record there. And I had the same questions as I saw this as I had with the first patient. Who was this person? What do we know about her? What can I find out about her? So since those days in the 60s and early 70s, I've had the opportunity to track down and learn something about these first two patients, and also about the physicians who identified sickle cell, and to write about them, as you saw from the references. The people that I'll be talking about are pioneers, both the patients and the physicians, though only the physicians, of course, knew this. The patients didn't know that they were being written about or had these new diseases that were just being recognized. The third and fourth cases of sickle cell were not reported until 1915 and 1922. The first case is 1910, second one's 1911. Here is the third case from St. Louis, from the Archives of Internal Medicine, and you see it references, you see the underlining there, it references the first two cases, and I'll say more about the author of the second one, R.E. Washburn, later on. And then the fourth case is 1922 at Johns Hopkins in Baltimore. And again, referencing back to the Herrick and Washburn articles from the early, a decade earlier. Over the remainder of the 20th, a flurry of activity then occurred after the fourth case. And sickle cell's genetic nature and its occurrence among people of African and Mediterranean descent was recognized. And then over the remainder of the 20th century in the U.S., sickle cell became a controversial disease. For example, some people in the U.S. saw sickle cell as a marker for race. If you had sickle cell, that meant that you were of African descent, black African descent. And in the U.S., that was, for some, a stigma, and so it raised all kinds of questions about race. Sickle cell was used as a way to keep African Americans with sickle cell trait, which of course is an asymptomatic version of sickle cell anemia, from becoming pilots in commercial and military settings. So another controversial aspect of sickle cell. In the 70s, screening programs to identify people with sickle cell were introduced, these screening programs, and African Americans saw this, many African Americans saw this as a possible worry about genocide, given the political climate of the 60s, 70s. People began to fear that this was a government plot against African Americans to restrict births of people of African descent. And most recently, sickle cell trait has become an issue with regard to the screening of athletes because of the sudden deaths of some athletes who were identified as having sickle cell trait. And so another whole area that we don't need to get into today. If you're interested in reading more about the politics and kind of societal aspects of sickle cell, there are two books I can recommend. One is Keith Whalew's book, Dying in the City of the Blues, and then Melbourne Tapper's book, In the Blood, Sickle Cell Anemia and the Politics of Race. So those would be two places to start if you're interested in reading more. So let's go back to the first decade of the 20th century, and we'll set the scene for the discovery of sickle cell. As I said, the time is the first decade of the 20th century, and the places are two cities, or two medical centers, one in Chicago and the other in Charlottesville, Virginia, at University of Virginia. But it's also a tale of two rural areas, the island of Grenada in the West Indies, as it was known, and the county of Campbell County in Virginia, which is where the second patient with sickle cell disease was from. The medical setting, this was an exciting time in medicine, the early 20th century. This was the time when germ theory was being recognized and accepted, when new bacteria were being discovered, when physical diagnosis was beginning to be used and understood and accepted, when antisepsis was allowing great strides in surgery so that hospitals could do surgeries in a safe way and patients would survive. And it was also a time when the basic sciences, biochemistry, physiology, pathology, etc., were becoming better understood and being taught in medical schools. In addition, specialization was beginning to occur as more knowledge of the body and of disease was discovered. Then people could focus on one part of the body or one stage of life, like pediatrics, and so specialization began to arise and become popular. Hematology was not a specialty, however, in this period, 1900 to 1910. But knowledge of the normal blood and composition of the blood was taking place. Rudolf Virchow had done work on blood cells, and Robert Koch and Paul Ehrlich were doing work on staining, and so different types of anemias were being recognized, leukemias, and so hematology was, though not a specialty at the time, was becoming an integral part of medicine in the period 1900 to 1910. The social setting, as opposed to the medical setting, integration was not a part of the American social scene. This was an era of growing racial segregation and of decreasing economic opportunities for African Americans in the American South. But it was also an era where there were islands of opportunities for African Americans wishing to enter professions, especially in the North and in some black medical schools in the South. And I have a picture here of, this is a group of graduates from Leonard Medical College in Raleigh, North Carolina, not far from where I live. It was one of a dozen or so African American medical schools and one of those islands of opportunities where African Americans could gain some education. Chicago was such an island. There were lots of medical and dental schools that accepted African Americans in Chicago. And this is a picture of Providence Hospital, which was one of the hospitals that had a nurse training school. It was founded by, the next slide, Daniel Hale Williams, who was a well-known African-American surgeon of that time period. He wanted to increase the numbers of African-American nurses and establish that hospital. So Chicago was one of those places where there was a small concentration of African-American professionals and of schools where African-Americans could gain health professions education. So you can go to the next slide, to that island of racial opportunity that is Chicago at the top of the screen here, from an island 2,500 miles away, you can see the bottom of that black arrow there, black line, the island of Grenada in the Caribbean, came the man who was the first sickle cell patient. And this map is from, I actually was able to go to Grenada and do some research there, and this was the map that was in the booklet, the magazine from British West Indies Airways back in the 80s when I was doing this research. Okay, so here is the story. I did research in Chicago where the first patient was a patient, at this hospital, Rush Presbyterian, was actually Rush Hospital, Presbyterian Hospital, I should say. That was where the patient was. I also was able to do some research at Loyola Dental School, which is where the patient was studying dentistry, what became Loyola, and at the University of Chicago. I'll come back to that. And then I also went to Washington, D.C. and did some research at the National Archives. It was at, and then went to Grenada for a week and did research there. The man whose information I was seeking was in Grenada and all the places where I was doing my research was this man, Walter Clement Noel, known to his family as Clemmy, Uncle Clemmy. He was, I have permission from the family to use his name, so there's no violation here of confidentiality. He was born in 1884 and died in 1916. Came from an upper-class planter family in Grenada. This is a map of the island of Grenada, and if you look at the bottom, as you're looking at the screen, the bottom left, you'll see in small type there, St. George's. That's the capital city of Grenada. There we go. Thank you. So that's the capital city. It was a British colony, a rather lush island, and go to the next slide, and grew, it still does grow, crops like bananas and mangoes and coconuts and spices. And being an island is surrounded, next slide, by water. Beautiful place. St. George's, the capital, next slide, is a very picturesque place. This is a picture of the bay Carenage, it's called, where the capital city lies. And I think there's another picture of, this is a picture taken in 1907, I believe, of the downtown in St. George's, Grenada. Noel grew up on the north side of the island, outside of a town called Sauteurs, as you see up there. He grew up on an estate called Duquesne Estate. Go to the next slide. This is a man who I met when I was doing my research, who is the step-nephew of Walter Clement Noel. His name is Cosmo St. Bernard. St. Bernard is a very common name in Grenada. He's a lawyer, still alive. This was taken in the 80s, but he's still alive as far as I know in the 2014. He helped me to identify where to go, who to find, and there's an interesting story about how I met him that you can read about in that article about my adventures. This is his cousin, Philip Alexis. Philip Alexis lives on the north side. Cosmo St. Bernard lives in St. George's and practices law there. Philip Alexis lives on the estate, on the Duquesne estate, and this is a picture of him standing on the steps of that's all that's left of the original house that Walter Clement Noel lived in. And the next picture is of what's left of the kitchen of the estate where the home where Walter Clement Noel lived. Walter Clement Noel was the son of these folks, Mary Justina Noel. You see her years there. She was the matriarch of the family and remarried after her husband, Walter Clement Noel's father, John Cornelius Noel, died. You see, he died rather young. It's not clear if he died of sickle cell complications. But Mary Justina Noel was apparently a formidable person, lived until the 1930s and ruled the household, the family household. This is the only picture that I have of members of that family from going back to the early 20th century. This is Mary Justina Noel as a young person. It was sitting in the home of Philip Alexis up at Duquesne Estate. I never was able to find a picture of Walter Clement Noel, and I'll say a little bit more about that in a few minutes. Noel got a good education, came from a wealthy family, and they could afford to send him to school, first in Sauteurs for primary school. Then he went to St. George's for his secondary education, and then went to Bridgetown in Barbados to Harrison's College, which is still in existence, and spent a couple of years there, 1901 to 1903. He decided then to study dentistry at the Chicago College of Dental Surgery, and here's the title page of the catalog from 1905, 1906, and this is a picture of the building itself, no longer standing, but right down in the medical district of Chicago. I'll have the map in a minute. So he graduated from Harrison College in 1903, decided to study dentistry, and in September 1904, he hopped on a boat called the SS Cearense, C-E-A-R-E-N-S-E, in case anybody's interested, left from Bridgetown in Barbados and sailed to New York City. 3 weeks before he left, good, great, a moving signal there. 3 weeks before he left, his mother, go to the next slide, wrote a note to the dean of this college, this dental college in Chicago. Dean Brophy was the man's name, Truman Brophy. And she said, "I will be very glad if you would take him," her son, take an interest in him, for some, and see that he does his work, especially as he is a stranger. A great letter from a mom to the dean of this august medical school, dental school, saying, take care of my son because he's a stranger. While Noel was on the boat going from Barbados to New York City, he developed a leg ulcer similar to some he already had and had healed from his growing up years. This is not a picture of Noel's ulcer, but just a typical sickle cell leg ulcer. He then continued on to Chicago, probably by train, and was able to find rented rooms. And you see number 7 there is where his room, where he lived, where he roomed. And number 1 is the Chicago College of Dental Surgery. So he had just a short walk. Those are fairly small blocks. Number 3 is Presbyterian Hospital, where he wound up being seen. And number 2 is Rush Medical School, right across the street from it. So everything is pretty compact. Everything was pretty compact where he was studying dentistry. So he started at the Chicago College of Dental Surgery in October of 1904, and there's his name, W.C. Noel from BWI, British West Indies. This is from the catalog of 1904-05. He started getting sick around Thanksgiving with some severe respiratory problems and coped until the day after Christmas. About 5 weeks later, he just sort of struggled through. And then, as you see on this map, just to remind you, so he went from his home, his rented rooms, number 7, to the hospital, Presbyterian Hospital, which was right nearby, number 3, right across the street and down the road. And here's a picture of the hospital from the annual report of the hospital. He was admitted to Ward 7, and this is the admission record. You see attending physician Dr. Herrick, that's the man who wrote the article. Dr. Irons was his intern, and then patient's name, and you see it says Occupation Dental School, Chicago, 20 years old, and all the other information that I've already mentioned. He was assigned to this intern, Ernest E. Irons, Ernest Everett Irons, and also James B. Herrick. So leave up the picture of, let's leave Irons up there for a minute. And I'll just say a little bit about him. He was just 7 years older than Noel. He was born in 1877. Noel had been born in 84. He was from Council Bluffs, Iowa, was a graduate of Rush Medical School the previous year, 1903. He was completing his internship at Presbyterian Hospital under Dr. Herrick in December of 04 when Noel came as a patient. He went on and got a PhD in bacteriology from the University of Chicago in 1912, became dean of Rush Medical School, his alma mater, from 1923 to 1936, and was even president of the American Medical Association, 1949 to 50. So he had a rather distinguished career after this encounter with sickle cell, which was his only encounter that we know of that he wrote about. So then the other person is James Bryan Herrick, James B. Herrick, 1861 to 1954, so a generation older than Irons and Noel. Herrick had a reputation in 1904. He was the attending physician at Cook County Hospital and at Presbyterian Hospital. And here's a picture of him. Next picture, if you could go on. There's a picture of him as house surgeon in 1889. There he is, down towards the left side of the screen there. He was professor of medicine at Rush, had graduated from Rush himself in 1888. So both Herrick and Irons were Rush graduates. Herrick later earned a national reputation and awards for his descriptions of and research into angina pectoris and coronary occlusion. So he had a reputation for that work as well. Irons, next slide, did a blood smear on that first admission and saw what he said were, quote, many pear-shaped and elongated forms, some small. And you see the picture there on the right. That's probably the first picture that we have of sickle cells. He drew that picture on December 31st, 1904. No clear diagnosis over the next 4 weeks. The doctors considered hookworm, yaws, syphilis, ground ditch, malaria, parasites, a bunch of things, and could not come up with a diagnosis. Meanwhile, Noel improved and was discharged well, quote. That was the way it was written up. Over the next 3 years, between 1904 and 1907, Herrick and Irons saw Noel at least 4 more times. And here's one of those. All of them appear under Irons' name. You see up at the top left there. This is his stationery. Noel always had anemia and always had those odd-shaped red blood cells. And you see, again, many elongated forms. So they recognized that he had these, whatever it was that was going on, and he had anemia. And then in April of 07, according to that article, that 1910 article that Herrick wrote, Noel disappears. And if you go to the next slide. So here's my symbolic disappearance of Walter Clement Noel from the view of his physicians in Chicago. And according to the article, they never saw him again or heard from him. So the question for the historian is, what happened to this guy? What happened to Walter Clement Noel? Well, he graduated from this school, from the Chicago College of Dental Surgery, May 28, 1907, which should have been kind of obvious to his doctors because they knew he was a dental student. And he went back to Grenada. Interestingly, though he graduated in 1907, maybe you can go back and leave that previous slide on. Yeah. So this school, Chicago College of Dental Surgery, became became part of Valparaiso University in Indiana, although it stayed in Chicago, and then ultimately became part of Loyola Dental School. And I went to Loyola Dental School as part of my research. And as I was walking towards the dean's office at the dental school, I was walking past all of the pictures of the classes that graduated. And so it would go from 1903 to 1904 to 1905 to 1906 to 1908 to 1909. No picture of the class of 1907, which was Walter Clement Noel's graduating class. Nobody has a picture. The dean's office didn't have that class picture, and none of the family in Grenada have pictures of Walter Clement Noel. So I put out my appeal one more time, as I do every time I talk about this. If anybody has any ideas about how to get a picture of Walter Clement Noel, that would be wonderful. It would be great to have a picture of the first sickle cell patient recognized in the medical literature. So, okay, so he goes to Grenada, goes back home. This is from the Grenada Handbook of 1912, and you see Walter Clement Noel. Oliver Charles Arthur was the man who helped Noel get into dental school in New York, in Chicago, I should say. Noel practiced dentistry until 1916 at this office at the corner of Young and Church Streets in the middle of St. George's. So this is a drawing of it, but if you go to the next slide, this is a picture from 1987 that I took of what was then called the People's Pharmacy. And Noel practiced on the first floor, and on the second floor was where he lived. His mother owned this building, and so he used it for his practice. Then I went back in 2010, and now it's a travel agency, same building, but there's no information other than that within the building itself. Interestingly, you'll see the picture of, right here of Cosmo St. Bernard standing there. He had knows a lot of people on the island, and one day he was helping me each day to think through how can we find out more information about his step-uncle, Walter Clement Noel. And he suggested that I meet with these two elderly ladies who were on either side of him. And I did that. I spoke to them, and they didn't know anything about Noel, but they said maybe Aunt Enid can help. And they brought out Aunt Enid, who was the lady on the right here, the far right. Aunt Enid, who was in her 90s in 1987 when I met her, had remembered Walter Clement Noel. She had been a student at the Anglican school up the street from Noel's office back in the early teens. And when she got a toothache, she was escorted down to the dental office of Walter Clement Noel, where he removed one of her teeth. She described him to me as smartly dressed with dark coffee-colored skin, healthy-looking, plump, with a round, fat face and a good body. So that's as good a description as we have of Walter Clement Noel, since we have no picture. Noel died on May 3rd, 1916 of pneumonia, which was is a typical cause of death in sickle cell disease, that is intercurrent infection. He actually had drawn up a will the year before in 1915. Maybe he anticipated that he might die young, so he wrote up his will, which we have. And then he was buried, next slide, in the Catholic Church at Sauteurs up on the north end of the island, where he went to primary school. And this is a picture of his grave and his father's grave. And I thank Graham Sargent for this picture. Dr. Sargent, of course, is a well-known sickle cell researcher now who lives and works in Jamaica. And if you go to the next slide, in 2010, when I went back to the 100th anniversary of the first article on sickle cell, his Gloria St. Bernard, which is Cosmo St. Bernard's sister, and is the lady in the yellow dress there, went with a group of us to the burial site of Walter Clement Noel at the cemetery, and we had a little ceremony. And if you'll go to the next slide, that was this plaque is what was behind that sash that was covering up one of the side entrances to the cemetery. In this cemetery lie the remains of Walter Clement Noel, and gives his birth and death dates. Great pride, a matter of pride to me as a historian, to know that it was because of the research that I've done that people on the island of Grenada, and in particular the St. Bernard family, know about their ancestor, Walter Clement Noel, and that we can identify him and point to him as the first identified patient with sickle cell. Okay, so 3 years later, Herrick presented this case that he had dealt with. This is May 1910 at the the Association of American Physicians in New York, I believe, and published the article also in 1910 in the Archives of Internal Medicine. You can go to the next slide, I believe, okay. Attached to that article was a blood smear, and you can go to the next, and there's the blood smear, actually handled at the University of Chicago manuscript collection in the Herrick papers is the slide that these came from. So the actual slide is as close as I've gotten to holding or seeing Walter Clement Noel in the flesh, so to speak. Herrick took, in the article, Herrick took the credit. He was the sole author for this article. Although he mentions Irons, even though Irons was probably the one who alerted Herrick to the unusual situation with the blood smear and all that Noel had. So I'd like to think that Irons is sort of the unsung hero in this story. Okay, so let's go on to the second patient. And this is now a picture of Benjamin Earl Washburn, who was a medical student at the University of Virginia, medical class of 1911. And there he is standing there. He was a fourth-year student, and he read the article that Herrick had written shortly after it came out. And in my imagination, he'd been caring for a woman who had what he noticed were similar blood smear. And here's a picture of the blood smear from Ellen Anthony, the second sickle cell patient. She had been admitted on October 25th of 1911 and 1910. And so let's go on to the next. Washburn, middle name with an E or not with an E at the end of it, was about the same age as Noel, and about 8 years younger than Irons. Who was he? He had gone to the University of North Carolina for his for college and for the first 2 years of medical school, and then transferred to the University of Virginia and graduated from there in 1911. His professor was John Stage Davis, Jr. This patient was very different from Walter Clement Noel. So let's go on and look at Ellen Anthony. She was born about the same time, about 1885, so she and her medical student caretaker, Benjamin Earl Washburn, were about the same age. But she grew up in a very poor rural family near Lynchburg, Virginia. It was easy to find information about Noel's family and impossible to find anything about Ellen Anthony and her family. Next slide is a map, and you can see down at the bottom left is Evington, which is the nearest small town to where she grew up, and you see Charlottesville up towards the top there. It was an easy train ride at that time to go from one to the other. Next slide. Ellen Anthony was a cook, a domestic worker from a farm family. She did laundry. Whenever she was well, she would work, but she was sickly most of the time. I can't tell if the family had sickle cell anemia, that is sickle cell disease, or not, because I have no information about them. I couldn't find anything about the mother, the father, the siblings. I looked in census records. I looked in manuscript collections. Couldn't find any descendants. Can't find death certificates. And I even just recently looked in Ancestry.com and still cannot find anything. They were an invisible family in rural central Virginia. When Washburn saw Ellen Anthony, she was on her 5th visit. And this is a list that I compiled of the, I think there were like 16 or 17 visits that she made. And you see number 5 there. Excuse me, that's the visit that when Washburn saw her. And so go on to the next. This is UVA Hospital, which had opened in 1907. She was put on the public black ward. There were separate wards for blacks and whites, and that's what this picture is. Washburn, wrote up the history. Presumably, it's interesting, he wrote the article, not his professor, John Stage Davis, unlike with the first case. I'll come back to that in a second. You see the same exact title for the article as with the first case. And if you'll go to the next slide, you'll see it says R.E. Washburn, but his name was Benjamin E. Washburn. He goes down in history with the wrong initials. Sad to say. Somebody, if you go to the next slide, somebody in one of the copies of the article that I found fixed it. It wasn't me. I got accused from some friends at the University of Virginia library of changing the name to make it correct, but somebody had fiddled around with it, not me. So what happened to Ellen Anthony? Well, we don't know. She was admitted 13 times, it is. Total of 13 times through June of 1918, and then she seems to have disappeared. I can't find any more information about her. So, interesting stories of these first two patients. Great contrast between them. So let's look first at authorship. It was Herrick, not Irons, the professor and not the student or the intern, who got the credit. In the second case, it was Washburn, the medical student, and not the attending, John Stage Davis, who got the credit. Interesting reversal there. With regard to the patients, the opportunities in the United States for Noel were quite available because he was, well, we'll see why, not for Anthony. Noel could go from the West Indies to Chicago to go to dental school. Anthony was trapped in the segregated South in Virginia. Noel was the social, economic, and professional equal of Herrick and Irons. He was well educated, he was articulate in the language of medicine. He was from the West Indies and had that wonderful lilting West Indian accent, not from the American South. As I said, he was educated, he had money, he was a good historian, he could tell what had happened to him accurately and believably to white physicians. He was a student, just like the folks who had been taking care of him. He was in a private hospital and not a public hospital. Anthony was very different, socially, economically, professionally, from the medical student Washburn and attending physician Davis. So you see the inside of both stories. You get a picture of society and of medicine, society and medicine in the U.S., and you get a picture of how they interacted in the discovery of sickle cell. There are no pictures of either of these folks, just their blood smears. And this is what I've got here. This is the two blood smears. And you just have to imagine the people in whom the blood smears that we see circulated. It's ironic that Ellen Anthony is so anonymous when the disease from which she suffered became one of the most studied in medicine. And I think, given the time, that I'll stop here, and maybe some other time I'll get to talk in the future about some of the other research I've done historically. Maybe I'll stop here, and if people have questions or comments, I'll provide an opportunity for that.
Okay, well, thank you so much, Dr. Savitt. At this time, we're going to go ahead and take any questions from the audience. Again, as I mentioned before, you can electronically raise your hand on the webinar screen and type in your question there, or you can individually unmute your line by pressing *6, and you can ask your question to Dr. Savitt directly. No questions from the audience? Okay, well, Dr. Savitt, you have the option of continuing your talk for the next 5 or 6 minutes, or we can end here. It's totally up to you.
Yeah, I think maybe we'll stop. And I'm afraid if I try to rush through it, it won't be the same. And maybe we can do it this another time.
Okay, sounds good. And we will be making a PDF version of the slides available. So if anyone wants to go back and reference the information at a later date, you will be able to do that. So Dr. Savitt, thank you so much for an excellent presentation. And for anyone who wants additional information about the webinar series, you can contact me directly at spope@cdc.gov. The next webinar will take place Thursday, March 27th. The topic will be Global Initiatives in Sickle Cell Disease by Dr. Kwaku Ohene-Frimpong. And at this time, we're going to go ahead and end the webinar. Thank you all so much.
You still there, Shay?